Hello, I'm Dr. Maria Sulindro. I'm specialized in integrative anti-aging medicine and practicing in Pasadena, California. I hope you're all doing well and none of you actually have gotten a recent fall or had a fracture because that would be very painful. Today, the uh, the event is to talk about keys to prevent falls and fracture. I'm going to tell you a little bit of some of my background. I did my residency in physical medicine and rehabilitation. Uh, those are not physical therapy, but it's physiatrist. And during my residency, what interested me was to um, to see why uh, do people get injured, why do people have a stroke. So I always ask why, and from that kind of angle, I always find or try to find how to prevent it. So with my background, I think talking about keys to prevent falls and fracture, I'm pretty confident that I can present the keys of what you need to understand. At the end of this presentation, half an hour, I want you to understand that the goal is for me to give you how to understand what falls means and why it can be dangerous to people and how can it affects our health. The fourth one is what is the risk of the falls? How can we prevent falls and fracture? And the last one for people who are concerned is falling a symptoms of dementia. Okay. Now, the first I would like to describe about falls for a very simple reason, such as tripping over the rock or sleeping on a wet floor, and that can change your life. Why? Well, you can have a broken bones. If a simple falls, you can go to the urgent care center if the pain persisted, or maybe the hospital if it's a little worse. And if you suspected there is a fracture, like definitely someone has to take an X-ray to find out. But if serious, you need a surgeon also to fix it because that happened to me once, and I did fracture my forearm here. It was very painful. It was just a simple fall. I uh, s- I stepped up the stool and the stool was not fixed by the nail, and then I just fall backwards. My head actually hit a big rock or stones, but luckily I did not have a concussion, but I was screaming like hell for maybe like 5 to 10 minutes because of the pain. So apparently I fractured my radius bone. So I out of one out of three elderly actually after 65 years old falls every year. Every year they find one out of three elderly. Well, how do you define elderly? I think after age 60, you just have to be careful and you have to consider that you need to change your speed. If you have only two speeds, like fast and faster, you have to add one more, which is slow or slower. So the risk of falling actually rises with age. So the older you are, the higher the risk of falling. Many people are afraid to fall. Many. Yes, but if you are not active because you are afraid to fall, it is not good for your health and might be worse actually because good simple walking and simple exercise and go to meet your friends or also getting in and out of the cars using maybe public transportation carefully will make you healthier than just sitting at home because you're afraid to fall, right? So this you have to understand. Now, what can cause falls? We have to review one by one. Let's say from the top to bottom, okay? Poor eyesight. When you wear glasses, you also have to really know what type of glasses you have, because I did once try that what is called progressive, where you can see close for reading and you can see far from reading far. I I did not have the far-sighted one, but I need to glasses to read clearly when it is close. Yeah. So poor eyesight can make you fall because when I was using that progressive, the step looks further. And so I misstep all the time. It's very dangerous. I dare not to use that expensive progressive um, glasses that I had. Now, what about poor hearing? Yes, poor hearing can cause also an imbalance problem, and some people who heard something very close but actually is in the front, but it seems like next to them, they are very they get them startled and they can fall or trip, right? Now, what about diminishing reflexes? Many of you do not know that the reflexes on the knee, when the doctor check your knee reflexes, they're actually checking a nervous system in your back. For example, the knee is the level of lumbar, fourth lumbar, and then the ankle is the level of the at the knee is the fourth. Yes, the fourth. The ankle is the fifth. Okay, ankle is the S1 sacral, and then the big toes. Remember, you the doctor asks you to persist on their pressing the big toe, and that is the fifth lumbar. Or you can also check the cervical level by testing your hand reflexes. So now, if you have a poor reflexes, um, it means like basically your response is not as fast, and you uh, the purpose for reflexes is so you can act fast. I mean naturally fast to prevent whatever is coming that is going to harm you, basically, or reflexes of the eyes. Yes, that is also to prevent the dust from going to your eyes. So these reflexes naturally diminished when you're older. So that alone tells you that as you're getting older, your risk of fall is increasing. You have to annually check all these system in your body. When you have diseases, for example, they can cause those problems such as disease like diabetes, because diabetes can be very systemic and it will affect your musculoskeletal and neurology or nervous system. So this is very important for those diabetic to maintain and control their sugar. Uh, the more it gets worse, the worse the problem with reflexes and the nervous system. How about the heart disease? By the way, diabetic also can cause diabetic um, eye problem, okay, oculodiabetica. So that one is going to affect their vision as well. What about heart disease? Yes, many people have palpitation and or skipping heartbeats that can affect their gait actually. Now, hypothyroid. Hypothyroid cause problem with heart rates. No, hypothyroid cause more problem with energy production, and but hyperthyroid cause problem with heart rate. So that can also cause the balance and people can fall. What about numbness and this neuropathy? Yes, numbness and neuropathy will definitely affect because it affects your directly your gait. So when you step, some people that has numbness, they do not feel what they're stepping on, or even if it's smooth or not smooth. So it will become a risk. If you take medication, what about taking medication that has side effects like dizziness and sleepiness, right? So you can also fall with from the effect of the drugs or prescription you are taking. Even food supplements, if you don't take it properly and you just take it, you don't even know when to take it, that can also cause falling. For the more drugs you take, the more risk you have of falling, because there are more side effects you get. Some road and area have problems with their levelness, so on the street, and it can cause older people to be imbalanced. And many of them have a problem with their hip, and some of them have total hip replacement or total knee replacement. And when they walk on the unlevel surface, they have a problem. They have to be careful. When you already have muscle weaknesses, for example, from taking statin drugs, that cause muscle weaknesses, that will cause problems with balance and gait. And then drugs that cause blood pressure changes, and even the drop in blood pressure as you have what they call postural hypertension, where you want to stand up from lying down. You have to be careful and just take 1 or 2 seconds to make sure you're okay and blood pressure is adjusted, then you can stand up. Otherwise, the uh, postural hypotension does cause falls. How about pain? Pain in the foot. Let's say you are having a problem with gout, and then it gives you an excessive pain when you walk. That can make you imbalance. And then if you have bunions that are inflamed, of course, yeah, or poor fitted shoes. Some people, they force themselves to wear such a beautiful shoes with high heel, with pointy head, okay? And so this one is going to cause a problem, because if they trip and they slip with their ankle inverted, then that can cause tendon rupture. It's very painful, and when you have ankle injury due to slip or fall, it heals very slow. It can take about like 1 or 2 years. Some elderly get confused, especially when you go to a place where you might be unfamiliar. This is very often. Make sure if you're going to visit a place that is new to you, you have a friend, or if you don't have a friend, make sure you go with a lower speed instead of running and walking fast. Okay. If you stay healthy, it is more likely that you can prevent fall. Why is that so? Well, how to prevent falls or reduce the risk of falling? There's several uh, steps. Okay, the first, you get enough sleep and you rest well. Now many people say between 6 to 8 hours. If you can sleep 6 to 8 hours, I think it's pretty good. But if you sleep 4 or 5 hours and you feel refreshed in the morning, that's a different story. Some people are like that. I used to be like that, but now I need my 8 hours beauty sleep. Yes. Okay. And then some people sleep more than that, like 10 hours, 12 hours. Due to like a certain gene mutation, they cannot sleep too long, because it makes them actually confused when they wake up. There is a gene mutation that allows you to just sleep no more than 8 hours, let's say. Number two, if you get medication, please read the side effects and know them well. Many patients, they trust their doctors, and they just think that the doctors knows what to do and give them prescription medication without telling them the side effects. It's not the doctor's fault because the pharmacies, I'm not finger pointing them, but the pharmacies has the obligation, they are obligated to tell the patient, or many they staple a drug information on the drug paperback, and then if you see something like that, it's not just a receipt. You have to read and understand what's the side effect of the drugs you're taking. The side effect of the drugs may not be 100%, meaning that if the side effects occurs in like maybe 0.0004% of population, that means 4 out of 1,000 people will have those side effects. And now they are very good. They describe the most um, uh, the most often side effects occurs, and then the less often occurs, and then very rare occurring. So this is good to know. Have your physical check every year by your primary care physician. Normally people do not have like a specialist all the time, but some of my patients, because they really would like to just stick with an integrative medicine approach, they ask me if I can be their primary care physician, but not just a consultant. So, as a specialist, we go through the regular general level of medical doctor. And so I, of course, know how to do physical exam, although I don't enjoy it, but I would tell my patient, okay, I'll do it. So just remember, in the month of your birth month, you have to remember to schedule your annual physical exam. Many consultants talk and try to understand from just the consultation, but some of the findings you have to touch and you have to listen. And those are done during physical exam or annual physical exam. Now, if you know that the doctor previously found something, let's say, oh, the other doctor found a tumor on my left breast, then you have to tell your next doctor, not just testing your doctor to see it, through your clothing, right? So, annual physical check is very important. And they usually check the eyes, they check your hearing, blood pressure, and reflexes, and from extremities. And they usually know your weakness and write it down in your chart. The fourth one, if you have a habit of drinking alcohol, and try to limit, as this has been proven in research to increase risk of imbalance. Alcohol. Okay, that's your drink, your favorite drink. If you need assistive device, now this is very difficult when you're only 70 and you're not 90. Even my 96 years old father-in-law, he refused to wear or use his cane. He would rather do exercise every morning, do a treadmill, exercise, walking, because he wants to be balanced. Okay, he stand on the ZAS, and he stay there 20 minutes, and sometimes 20 times two, 20 minutes times two a day or twice a day, to improve his balance, because he knows if he falls, he fell twice before, but if he falls again, he might break his bone. And he's 96. It's very difficult. No surgeon or doctor dare to do an operation if you break bones when you are close to 100. So it just happened to my sister's mother-in-law, and she's 93. She sleep and fall in her own bedroom, and guess what? She broke her femur that has the prosthesis on her right hip. So, because of the severe pain and complication, they have to wait for 4 to 5 days before they decided that she has to go through surgery. Thank God it went very well. So she's now back home, and this just happened last month. So it's very difficult to not know what to do to prevent falls. Okay, you have to know. So this assistive device is usually a cane, single point, or quad quad quadri quad quad cane. Quad cane is four prong of the leg. So the leg has an extension. It can be the right or the left, but it has four like big fingers coming out. Okay, and that is more steady than just one single point cane. And the cane has to be measured. So when you use the cane to support, let's say if you have problem always on the left, use your cane on the right. And you have to adjust the cane's height so that your elbow just flex or bend 30 degrees. And that is where your cane should be, because that is, let's say you have the right hip pain, then or right knee pain, you walk with the left single point cane, right? And then when you step your painful leg, that's where your cane actually step together to the front. And then you lean towards the cane, because if you lean towards the painful leg, then it's going to make it worse, right? So you have to lean towards the cane. So the cane is called um, 3-point gait. So the cane is your right leg, or to replace your right leg, and then after you lean to the you lean to the left, and your weight is to the cane, and then you completed the step of that right painful leg, and then you can step with the good leg to the front. So all of these, you happen to if you think you happen to need assistive device, you can ask your doctor to send you to one of the physical therapists who can train you how to walk with an assistive device at home. It doesn't mean that it looks easy, but that's because you already know how to use it. But when you use it wrong, it makes the condition worse. Okay. Now, please do not refuse if you need assistive device, let's say walker or cane, because this means you need help to balance, and this will prevent falls. It doesn't look as young, right? But just accept it. Next one. You have to be more careful. So you stand up slowly and be aware that you can fall at any time when you miss your step or stairs or you slip. So just be aware you can fall. So this way you can be more careful. Okay. Um, what about the footwear, the shoes? Yes, check your shoes. Wear something appropriate for your age, and buy the shoes that and sandal that can support your step. Yeah. Now the fashion is so good that even if you wear dresses, you can also wear tennis shoe. So I'm so happy to see that around us. And flat shoes doesn't mean more comfortable if you are used to high heel, but if you are used to high heel, 3 inches, 4 inches, now when you reach 60, you just use 1 inch. That's good enough, or half an inch. That's good. Now the reason why you cannot right away go to with walk with the flat shoes, because your Achilles tendon has actually um, go into contraction. So it is shortened when you wear high heel. But if you wear flat shoes all the time, then your Achilles will get stretched again, and then eventually you'll feel comfortable with the flat shoes. We know that grounding, I did grounding YouTube video, And it's very good electron nutrition transfer when you're barefoot. And so this, please exercise. And if you don't know what grounding is, you Google it, and you can find a book called Earthing, Grounding, Earthing. They're both the same. Many grounding videos everywhere. Next one is very important that you document when you fall. And even though it didn't hurt you, you have to document it, the date and when and how. Let me tell you why. The next time you see your doctor, you tell your doctor, "Doctor, the other day I fell." And then he might use it as a warning to find if you have a new medical problem. Trust me, you have to tell your doctor. If I have a patient and they told me that they fall, I always think about neurological problem, right? Even though they do not have fracture or they didn't injured, we always have to be very careful, because even let's say a stroke, okay, there is a condition called TIA, Transient Ischemic Attack, and this one is a stroke, but it happened and you recover within 24 hours without sequelae. What does it mean? Means that when they check your brain, checking with MRI, with CT scan, they couldn't find anything. But when you describe to your doctor, he knows you had TIAs and what happened, what to do next. The doctor will check all the markers. It's called biomarkers in your blood test, and they will decide whether you do have soft plaque that maybe are broken, and then traveling, and then when it comes to a place where it's very narrow, it causes you that stroke symptoms, but then for some reason it flows again, then you are normal again. So that doesn't mean that you're done. That is a warning sign of the next stroke. Okay, now if you fall anywhere, try to stay as calm as possible. Everyone who fall will get shocked and upset due to the off-guard situations. That is understood. So stay calm as possible, unless you are in the water, right? If you fall in the sea, not please not to be too calm, because you have to try to bring yourself above the water so you can breathe. Now, if you fall off guard and you fall on or land on the street or at home, try to take several deep breaths and try to relax. Okay, remain still on the floor or the ground for a few moments. This will help you get over the shock of falling. Just get over the shock first. And then getting up too quickly in the wrong position might make it even worse. Okay? So think first if you have any pain. Think if you can get up without help. Yeah? Turn over to your side slowly, and then let the blood pressure get adjusted in that position. And if you cannot, then you crawl slowly and find the object, like maybe a table or a chair, that are very sturdy, not the wiggly one. And then crawl to a sturdy object with your arm on that are not injured. Then use your arm and the uninjured leg to support your body to stand up. Then what? Then rest. Sit down, rest, and do inventories, meaning check again if any part of your body is, painful. Okay? So this is very important, not to get up too quickly just because you're shy or you're in public. Just don't care. This is not their business. This is your body. Okay. So you have, because if you get up and you sprain your muscle too quickly with all this condition, you might sprain your muscle. All right. Nowadays, many people carry their handphone all the time, almost like their third eye. Then it's easier to call 911, or many has an emergency button system. You see all these elderly people around their neck, okay, special necklace or bracelet to call for help. But then this is also another option. However, for people who are very busy, many of them, they put their phone somewhere. And when this happens, they are far away from their phone. Now, what happened? What happened when this fall is causing a lot of problem that they cannot even get up? Well, at least try to crawl and to the nearest telephone and call 911, especially when you are alone. Many falls cause fracture because the bones are not too strong, right? But having a strong bones won't prevent a fall. But if you fall, it might prevent fracture if you have a strong bone. Okay, so many falls I said causes fracture because the bones are not strong. So obviously here we have to make the bones strong. When you reach 40, 45, when your hormone is not balanced, progesterone is already coming down to the level where it's not optimal, your bone can be losing the density. So if you fracture the bone, of course, it can lead to surgery or hospitalization or nursing home stay or sometimes death, because fracture can cause embolism and the blood clot can travel. Sometimes it travels more than few hours. You could be discharged from the hospital to go home, and then you can have pulmonary embolism where this blood clots go to the lung and clog uh, the big branch to breathe. You cannot breathe and you die. Okay, so that's why fall can be dangerous. How to prevent this bone loss, or is called osteoporosis? Number one, check your bone density and start the program when it's already osteopenia. That's the result. Like before you have osteoporosis, your bone is weak, is called osteopenia. Now, always start the program then. Hopefully, you can go back to normal bone. And number two, those especially who has a habit of drinking caffeinated tea and also coffee. Okay, so the caffeine will eventually uh, bind the not eventually it binds the magnesium and it leaches out through your urine, and then you have a very weak bone because magnesium and calcium that makes the bone. Magnesium bring the calcium to the bone, and the vitamin D and strontium actually glue your calcium to the bone, so it will improve the density. uh, if you read about this osteopenia and osteoporosis, you will be so surprised. Many people have this one, and this is the number one bone disease in the world. Now, how can that be? Well, because tea time and coffee time has been part of the lifestyle nowadays. Many people, they enjoy these meeting friends. They don't have to spend too much money to buy the food, but they buy cup of tea, or they just drink coffee and talk, and so this has been our culture for almost 40 years. The osteoporosis disease is not going down, is going up regardless of the drugs that they found, because the drug itself, if you take too long, it actually counteract, and the bone that actually are built uh, will be eaten by an osteoclast. So you build osteoblast, and then when you build too much, then the osteoclast eat the bone again. Just be careful. So there are two ways in integrative medicine. You can start with the medication first for the first 2 years, but from the very beginning, we always give our patients calcium, magnesium, vitamin D, strontium, and then we build it slowly. And I have done that many times, and patients are very happy. Now, um, don't forget, you have to quit bad habit, smoking, alcohol use, and keep healthy weight maintenance, not too skinny. Okay, I know at some point people wants to be very skinny, but skinny people break their bone easier than uh, uh, not obese. Okay, of course, obese is hard to break the bone, yeah. But then, basically, if people do not have muscle, do not have fat, when fall, they fall to their bone, right? So they fracture their bone. Now, what to do now? Okay, so there is a way to fall proof your home, right? 60% of the fall happen at home, where we spend much of our time usually at home and tend to move around without thinking about our safety because we know where the door, where the light, and everything. Some people even dare to not turn on the light while they walk in their house because they know where is the step and all these things, right? If you have stairs, hold on to the handrails going up or down. If you carry something, make sure it is only in one hand, not in two hands, and then you step down or step up. If you carry in one hand, make sure these products or baggage does not cover your vision to the stairs. Okay? Now, remember to turn on the light up or downstairs, and also the hallways. Even you know in your mind that the hallway is very straight and nothing will be there, turn on the light. For especially when people have animals like cats or dogs. You sometimes you cannot see. When you're old, you know, you just cannot see, right? So be careful. Just turn on the light, make sure your path is clear. Okay. And some people read books and then they just put the books and stack it on the floor. And some people do not have big houses, so they only have like a small hallway. So make sure those blocks, books are not blocking the way your way to the bathroom in the middle of the night, just in case you need to go to the bathroom. Now, try not to use a small rock area because it can slip. And if you have the strip that glue the rock down to the floor, use that one. It's better. Just glue it and you're safe. Okay. What about bathrooms? Many people fall in their bathrooms. In fact, some bad news. People died when they fall in the bathroom because no one knows that they fell in the bathroom. They locked the bathroom. Now, if you're already old, what, 90, 100? I told my father when he reached 90 not to lock the bathroom when he gets in. He Once my father was trying to relax in the jacuzzi in the bathroom in the bathtub. They have the jacuzzi system. He was lying there. He fell asleep. Okay, the water went up to his neck, but because of the jacuzzi is hot, and his blood pressure actually drops, and he went into he fainted. He fainted in there. Luckily, my brother-in-law waited for him to have breakfast, and after a couple hours, he was kind of like suspicious, and he knocked on the door, and he did not open the door, and he locked it. So he just break the door in and call 911. He was transported to the hospital. Luckily, we saved his life. What if he fall asleep and he goes down further in the water? Well, hopefully you wake up when that happens. But many patients are so tired after, let's say, 15 hours of flight. He actually just came back from here to Singapore. You see, so be careful. uh, all kind of fall is bad, but just be careful that this can happen. So in the bathrooms, mount the grab bars near toilets, because that's when you sit for a while, and when you try to wake up you might need some help. Okay, both inside and outside your tub and shower, put the bars. They are removable bar, and with a suction, that is also good. Or you can mount bars there. Place non-skid mat, okay, or carpet on all surfaces that may get wet. That's very important. Remember automatic or dark sensor night lights in the restroom. So basically, when it's dark, this light turns on, but it's not very bright. I think that is a good idea, and put it at the bottom of the plug that is low, not high. The reason why, when you want to sleep, you don't want to see any light again. And remember, when you buy the night light, do not buy the bright night light. It's just a soft light. No blue light whatsoever. Red light is okay. Blue light is what? Is your cell phone is blue light. The UV, that's blue light. So be careful with the blue light, because that can stimulate your brain, and you cannot go back to sleep uh, when when you wake up in the middle of the night and you still want to go back to sleep, right? And so your cell phone, if you are afraid that you might call 911, just in case, as they grow older and they people stay alone, they have to think about what to do if something happened. I tell you a story. I have a neighbor just across the street. The husband passed away, and passed away first from the cardiac attack, heart attack, and then the wife live alone. She was maybe 92, and the children are were in San Diego, and so they usually call every day. And this happened probably in the evening. She fell. Okay, she has a button on as a necklace. Somehow her position did not allow her to push that button. Maybe she fell, and then she fell on her chest. And she managed to crawl, because she was going to call the family, probably, yeah, because it's an old telephone system. So she crawled, and then she put her arm, reach her arm to the phone, the table where the phone is, and she died like that. I mean, we found her in that position. So she could not even reach the phone to call anyone. So this kind of accident or incident happen all the time. So now elderly people also think, what if happened to me? So they have this cell phone that they can call emergency with them all the time. I don't mind they have their cell phone next to them when they sleep, but please um, put it upside down, meaning that the light is not upright. Okay, so I think that is the best way. Keep a flashlight probably next by your bed in case power is out and you need to get up, and then cell phone is low in battery. That happened, right? And then keep your well, the cell phone is a blue light. That's the only problem. And also it's wireless. So when you sleep not grounded, and if you learn how to ground yourself when you sleep, let's say by buying like a under the sheet, you can put another sheet that is grounded. You can buy that one. And then that means you're grounded. Then I think it's safer if the cell phone is next to you. But if you don't have a grounding system, that cell phone, even though it's off and uh, basically it's still there, it's still radiating 8 feet away. All right, now next one. furnitures. Yeah, furnitures. Arrange your furnitures so not to block your way when you walk. Sofas, chairs are at the right height for you to get in and out of them easily, right? Some sofas, when it's too low, you cannot get up easily. When it's too high, you cannot even sit comfortably. So, I mean, as you grow older, I think there are special furnitures for you. So you have to understand it's very difficult as you grow older. Maybe you reach 90, maybe it's very difficult, right? But if you are in the 70s, maybe it's still okay and you still feel that you're young, and that's when you refuse all devices and help. But I'm telling you, this lecture is not only for elderly, it's for everyone. Rich, what is that called? Rich stick, right? You know what rich stick is? It's a stick where you can use the handle to close and open the other end, so you can reach something with that stick. That can be very handy. I i used to see it in this house, but now I don't know where it is. So we have to also do this checklist for ourselves. But I hope my husband is doing that because he's older. Steady stepping stool. So stepping stool. Did you ever watch the video where people step on the stool and then they fall because the stool went to the left and the body went to the right? So this steady stepping stool is very important, and hopefully it has a handrail on the top, so you can actually hold onto that handrail. I mean, to that handle, or have someone stand next to you if you want to step up on that stepping stool. Don't let your cat or dog trip you. It's very easy because they love you. They go follow you everywhere, and then there you go. You trip, and because they are next to you and you did not even see them. Make sure make sure you don't trip over them. Keep an emergency numbers in a large print near each telephone, right? When you fall, you are shocked. Sometimes you cannot even think, what is that number? Is it 119, 919, 911? You cannot think. And then the more you make mistake, the more you become nervous, anxious, right? So your doctor might suggest that a physical therapist or a nurse to visit your home to do is called evaluation of the home safety. Take it because it is covered by Medicare, by the way. Especially if a physiatrist like me write this prescription, they'll go to your house, check everything, whatever you need. Sometimes prescription of devices, Medicare covers. Okay, everyone falls now and again, but frequent falling could be an early signal of Alzheimer's disease. This is very scary. According to research, that is what they found. A study published in July of 2013 in the Journal of Neurology found that presumptive preclinical Alzheimer's um, is a risk factor for falls in elderly. Also, another research study on February 27, 2019. It's a little scary, but um, there are different personal risk factors that cause people to fall. However, people with dementia are at a greater risk because they are more likely to experience problems with mobility, balance, muscle weakness. They can have difficulties with their memory and finding their way around. Last, falls are an inevitable part of living with dementia. However, some symptoms can make people with dementia more at risk of falls. People with dementia can also have the same health conditions that increase the risk of falls as people who don't have dementia. Okay, so take home message, review again this YouTube, and then you can find maybe things that you can add here. I'd like to know what you think about that, and let's see. Um, yes, thank you, Agnes. So, good content for seniors to be more aware and careful. Yes, this is it. I want people to be more aware and careful. And Victor, thank you. Loose mats that are not anchored, especially in the bathroom, are another cause of fall. Yes, that is for sure. Be careful. And then Colleen, Dr. Maria, getting older is not for the faint of heart. Well, we all have to get older. Let's put it that way. But we don't want to fall and break our bones when we are old enough because some doctors they just don't want to fix it when you're too old. I have to force my doctor seriously when he put plates and screw in my wrist cause me insomnia because the pain of the screw and the plates it's there after 2 months, but I heal very fast. I took supplements to help me heal faster, and so 2 months was in the month of November. So I told my orthopedic surgeon or hand surgeon, I said, you please remove the plate and the screw because I cannot tolerate pain medication. And then he said, oh no, let it sit there for 6 months. I said, no, I want it out because I need to sleep. And he said, no, you cannot take it out too fast and too soon. And I said, well, if it's past December and you don't take it out, you pay my deductible. So he took it out in December. That's just a story. And after he took it out, I healed and my rehabilitation went very fast. And now I have hands that are equally functional. And this is my dominant hands that I had a broken radius. So thank God I heal very fast, and hopefully this topic helps everyone. Thank you, everyone. Thank you for listening, and basically I'll see you next week. This is Dr. Maria Sulindro, specializing in physical medicine and rehab with pain management, but I'm practicing integrative medicine in Pasadena, California. Thanks so much. Bye.